With the new EyeSpecial C III, Shofu has gone one step further. The EyeSpecial C III is a digital camera designed specifically for use in dental practices and laboratories. This compact 12-megapixel camera features a zoom macro lens with a focal length of 28 to 300mm converted for 35mm format and a built-in lighting system consisting of 4 LEDs located near the lens and 4 lateral flashes. Depending on the photographic situation, the camera separately actuates the inside lateral flashes or the outside lateral flashes, which are angulated by 45 degrees. This integrated flash system of the EyeSpecial C III optimally lights most dental imaging situations. The outside flashes make pictures of anterior teeth appear very plastic, while the inside flashes ensure proper lighting of intraoral images taken with a photomirror. For each shooting mode selected, the camera chooses a suitable flash setting, and thanks to the quick and accurate autofocus function, you can basically concentrate on choosing the right image section. Attach the hand strap and insert rechargeable or non-rechargeable batteries into the battery compartment at the bottom. Then insert a memory card. SD and SDHC cards are compatible, SDXC cards cannot be used. At the front of the camera you see the power switch, the shutter button, the pilot lamp, the outside and inside lateral flashes, the lens and the LED lights. You can operate your camera using either the touchscreen or the function keys, which are also located at the back. To make your camera work in any clinical situation, the touchscreen keys will react even when touched with gloved fingers or with a pen. Please do not use any sharp instruments, because they would scratch the screen. Thanks to its exceptional water resistance, the EyeSpecial C III can easily be wiped with any commercially available ethanol-based disinfectant. At the back of the camera you see the function keys and also the dial key allowing you to select the desired shooting mode. Detailed information will follow later. The EyeSpecial C III is ergonomic and lightweight. It weighs only 590 grams, much less than a conventional single-lens reflex camera. So you can take sharp, high-quality photographs without any fatigue, even when one-handedly operating your camera for extended periods of time. Remove the lens cap and turn the power switch to activate your camera. As you know from your private digital camera, a few settings are required to get started. Language, date format, date and time. Now you can enter the patient data, either by photographing the file or by entering a number in the display. Press the F3 key in the shooting mode and enter the necessary information. The patient ID number will then be displayed on the bottom right of the screen. A few tips before taking your first photo. In contrast to a conventional single-lens reflex camera, the distance between the EyeSpecial C III and the subject should be within the range recommended by the camera. All subjects in your photos will then always be the same size when the light is uniformly distributed. To save as much battery power as possible, the EyeSpecial C III will automatically switch off when not in use for 30 minutes. If you wish to continue to use your camera, switch it off and on again. To hold your EyeSpecial C III safely and without shaking, we recommend stabilizing your upper body. If you can use both hands to take pictures, hold your camera in your right hand while your left hand supports the camera from below. As already mentioned, the EyeSpecial C III differs from a conventional single-lens reflex camera with regard to the focusing distance. The distance between the EyeSpecial C III and the subject should be within a range recommended by the camera. Adjust the camera position until the subject is displayed sharply on the screen. In the different shooting modes you can set the magnification factor using the dial key, for example in the face mode to take mouth, face and half-body images. You can focus on a subject by half-pressing the shutter button. When the focus is properly selected, 4 green indicators will appear in the autofocus frame. While you press the shutter button halfway down, the selected focus will be frozen. If you now change the camera to subject distance, your image will not be sharp. Should you wish to change the distance, simply release the shutter button and half press it again. Then press the button all the way down to take a high-quality image in the mode chosen. The image taken will be displayed in an immediate preview, and you can decide whether you want to keep or repeat it. A tip on how to press the shutter button. To get a feeling for the pressure to use, it has proved helpful to take a few test shots before actually using the camera. In addition to the standard autofocus function, the EyeSpecial C III also features a spot autofocus function, allowing you to individually determine the focus. To activate this function, touch the LED screen in the shooting mode. In this way, you will move the area touched into the center of the focus. The activation of spot autofocus is just as easy. Hold your finger on the spot focused area for a few seconds and your camera will return to the standard autofocus function. When you press the Set key once, the subject will be twice magnified. When you press the key once again, it will be 4 times magnified. Pressing for a third time will reset magnification to the initial value. The magnified views displayed on the screen are only designed to facilitate focusing. The camera will not take the magnified image displayed. The EyeSpecial C III has been designed with ease of use in mind. The camera is very handy, compact, lightweight and intuitive to use. This also simplifies communication with dental laboratories and, of course, with patients. The EyeSpecial C III offers you 8 shooting modes to choose from. Whatever imaging situation you encounter in dental practice, you will always have the ideal program. For each mode selected, the camera automatically adjusts the relevant exposure parameters, exposure time, aperture and flash setting, and recommends the optimal camera to subject distance. Images ranging from the anterior teeth to the first molars can be taken with continuous sharpness. Press Mode on the touchscreen or the F1 key to display all 8 preset shooting modes of your EyeSpecial C III. The modes are Standard, Surgery, Mirror, Phase, Low Glare, Whitening, Telemacro and Isolate Shade. Use the F4 key to switch between the mode list and the mode overview. The standard mode is used to take frontal images without a photo mirror and document clinical findings to support diagnostics. The desired image section is selected by turning the dial key. The optimal focusing distance is displayed in the upper left area of the screen. This feature helps you easily and reliably determine the correct camera to subject distance. The surgery mode, as its name implies, is designed specifically for the documentation of surgical treatments, but also well suited for restorative treatments. The camera to subject distance is a little greater in this mode, so that you can optimally photograph clinical situations in which you do not wish to get too close to the subject. The mirror mode supports intraoral photography with the aid of a mirror. In this mode, mainly the inside lateral flashes light the imaging situation. Depending on the type of photomirror used, the reflection behavior may vary, and it may be necessary to manually adjust the flash intensity. The standard flash intensity setting of plus 0.7 is based on the use of chrome-plated mirrors with a reflection index of approximately 65%. When using rhodium or titanium plated mirrors, the flash intensity should be reduced to plus 0.3 due to increased reflection. And in the case of ultra-bright mirrors, the brightness compensation in the flash menu should be reduced to plus 0. The photo taken is automatically mirrored. so that it will be available as a right-reading image immediately after shooting without any further editing. This is a great advantage over smartphones or single-lens reflex cameras, which require the user to perform this step manually. The face mode is ideal for facial photographs or half-body portraits. It helps to optimize cooperation with dental laboratories. When the up icon appears on the screen, please move your camera in the direction shown by the arrow. The face settings allow you to take high-quality patient portraits without the need for any accessories. Especially in orthodontics, full face and profile photos are routinely taken today. The low glare mode slightly reduces the intensity of the inside lateral flashes. This helps to create images with minimized reflections which clearly depict highly transparent incisal regions. Low glare is particularly suitable for photographing details of anterior teeth, working models, or indirect restorations. The whitening mode features similar parameters as low glare. However, the light intensity of the inside lateral flashes is lower, which helps to accentuate the surface structure and the shade of the teeth, so that the result of a whitening procedure can be objectively assessed. To better visualize the result for the patient, it has proved useful to photographically document the treatment success. The telemacro mode allows you to accurately photograph details of anterior teeth. The EyeSpecial C III includes a screw-on close-up lens for intra- and extra-oral close-ups. This mode is very helpful for the documentation of minimally invasive treatments and detailed tooth characteristics. Like the other modes, telemacro produces high-quality images without the need for additional light sources. You can reliably take pictures with a mirror, which are ideal for patient information. The isolate shade mode is also important for cooperation with dental laboratories. This mode takes two different images. The first image shows the situation in true colors. The second image automatically masks the gingiva. The soft tissues are displayed in gray and only the teeth are visible in true colors. This allows you to optimally assess the tooth shade in comparison with the reference shade included in the photograph. All that works automatically, without the need for any further actions or adjustments. So isolate shade adds real value to the cooperation between dentist and laboratory. It has proved most successful to use the standard mode to document the initial situation, the face mode to provide information on aesthetic reference lines, the isolate shade mode to select the shade, and the low glare mode to show incisal transparencies of the reference teeth. Of course, you can edit images taken with your EyeSpecial C III. You can, for instance, rotate or enlarge your photos, or also directly on the screen add drawings to photos you have saved. Simply press the menu key and select your next action in the dialog box. After choosing the paint option from the menu, you can use the F2 key to select lines and add them to your photos with a plastic stylus or your fingertip. The F3 key allows you to easily erase these lines. The F4 key deletes up to 5 previous actions. When your drawing is complete, press the F1 key, choose the Save option, and the edited image will be saved. Of course, the camera will also automatically save the unedited original version of your image. Naturally, you can rotate your images. After choosing the rotate option from the menu, use the F2 key to rotate your photo clockwise by 90 degrees or the F3 key to rotate it anti-clockwise by 90 degrees. When using this function, you can also save the edited images. Press the F1 key and choose the Save option. Again, the camera will automatically save the unedited version of your image. A few PC programs such as Windows Picture Manager or Windows Fax Viewer and Windows XP will not display any rotated images. This is caused by software compatibility problems, not by a malfunction of your camera.